Welcome to IMCAS TV, 10 Minutes with two American plastic surgeons, Dr. Corey, Dr. Delvecchio, welcome. Our topic is fat and stem cells, and Dr. Corey, you are a plastic surgeon in the United States with more than 20 years of experience with breast reconstruction. You are known internationally for your innovative alternative procedure of minimally invasive breast reconstruction. Dr. Delvecchio, a plastic surgeon at Mass General in Boston, and the creator of a novel procedure, simultaneous implant exchange with fat, which I hope we can speak about later. Dr. Curry, you have worked a long time on stem cells, otherwise known as regenerative materials. Can you tell us about extracting, cultivating, and finally, their application?
I've worked a lot on fat cells, on fat harvesting, and fat transfer. Just like I work a lot on tissue transfer, microsurgery, and free flaps. So my specialty in plastic surgery has really been taking tissue from one part of the body and making sure it survives in a different part of the body, which is the ultimate plastic surgery.
There are stem cells in tissue. I mean, there's stem cells in fat, there's stem cells.
Exactly, exactly. There's stem cells in a skin graft. There's stem cells in a bone graft. I have not actively tried to isolate them, cultivate them, and re-inject them. Others have. I think this is a very exciting field. The problem is it's been hyped beyond the real science.
Right, right. And what are your particular techniques for lipofilling?
Well, I take the fat and I manipulate it the least possible to make sure it survives. I graft it back tiny droplet at a time to make sure all of these survive, and I make sure I put the right amount. I don't make it a point to specifically harvest the stem cells. However, I do work on activating whatever stem cells is present in the body. So we work on expansion of the tissue because expansion activates and generates tissue. So a lot of my work has been on preparing the soil where you put those grafts.
Right, you're laying the groundwork.
You need to make sure, even if you have the best seeds in the world, if you don't have a good soil to put them, they're not going to help.
They're not growing. Right,
exactly.
right. And Dr. Delvecchio, where are we now with stem cells in terms of legislation and stem cell production?
Well, there are two general methods of isolating or concentrating the cells. One is to literally digest the fat and retain the stem cells and then add them back to some other fat that you're going to inject. That type of strategy has not been approved for use in the United States for reasons that you're manipulating the cells. The other interesting way you can concentrate stem cells is literally by driving them in a centrifuge. You get the smaller cells to drop to the bottom. And if you get those cells and collect the bottom pellet of a centrifuge fat, you will get a higher concentration of stem cells. And I see that as probably the near-term or immediate-term way that we can use a higher concentration
of stem cells. And there is a lot of controversy about stem cell application, but like we were talking about, you really just use tissue. You don't use pure stem cell in your technique. In fact, there may be stem cells in all of the ingredients, but it's not the main ingredient. Under what circumstances does stem cell therapy need FDA approval?
Well, I'll say two quick things. Somewhere along the line, someone somewhere made this assumption that adding stem cells to fat, when fat was used in large volumes, would make fat survival better. And I think that's just been perpetuated over time, and we don't really know that's true. The second thing is that stem cells probably do have a role when we're dealing with diseased tissue, small areas like wounds that are open that won't heal, radiation. There we can probably see a near-term feasibility of taking highly concentrated stem cells and applying them to tissue that's diseased. That's very different than what Roger's doing with large volumes to the breast.
Right, right. And can you talk about different grafting techniques and how are you getting the best results? And also, just to go a little further, with the regenerative aspect of fat grafting.
Well, what we're doing really is tissue engineering.
Right.
We prepare the scaffold, we prepare the breast, the recipient tissue, and then seed it with the cells. That's what tissue engineers do. They have a scaffold that they seed with cells. Well, we prepare the scaffold, whether by using the expander or by stretching it or by nicking it so that the scar becomes a recipient mesh. And then we add the fat that we harvest through liposuction. Now we harvest very gently and we re-inject a droplet at a time. At this point, legislation doesn't allow us to manipulate it, and there's no science to show that if we manipulate it one way or another, we improve it. Certainly some work along the way would prove it one day, hopefully. But at this point, jumping the gun and doing anything,
jumping the gun.
Adding anything to it and claiming better result is not true.
It hasn't been proven, and it's not true. Has it been disproven?
Well, the burden is not to disprove.
Right.
The burden is to prove that you're better than what's been done. And what we're doing, Dan and I have shown some results that, we established a standard with simple fat. Now, if you can show something better, then welcome.
Right,
we're welcome.
right. And besides breast, what other parts of the body is fat grafting being utilized?
Well, obviously, Sid Coleman pioneered fat grafting to the face. We all know that. I think the real hot area is the buttock. In the United States, and probably less so in Europe, the buttock is becoming kind of the final aesthetic frontier. And I think we're paying more attention to the aesthetics of the buttock. And certainly some of us in the United States are paying more attention to volume enhancing the buttock.
And now the tough part about what you do is the final distribution of fat. How do you know how much to inject, where to inject, and the tolerance level of the area that you're going to inject?
That is exactly the point. Because it's easy to take the syringe and keep on injecting.
Right.
You have to know when to stop.
Right.
You inject too much, diminishing returns. The more you inject, the worse things get. And so one way we have a little monitor that tells us that the pressure is reached. You fill the container, you can't put more. That's one way of telling it. Experience is really the key factor.
Experience, of course. There's no substitute. We do have a little bit of time, and I do want to get into your technique for replacing breast volume in patients seeking the removal of their implants. Can you tell us about your experience, I think both of you, with simultaneous implant exchange with fat? And I think you're nicknaming it SIEF, S-I-E-F.
Right, Pamela. Well, there are 400,000 breast augmentations in the United States a year. So over the years, there are literally millions of women who have problems with their breast implants, typically the saline implants that have a really high riding look. And those women who are approaching their 40s, 50s, had them 20 years ago, really don't like that look, and some of them want those implants removed. The problem is that we don't really have a good solution for them besides putting a new implant in. We've developed some techniques to be able to replace that implant with fat, putting it not in the space where the implant was, but putting it over the implant in the subcutaneous tissue. And Roger's done a fair number of these as well, but I think the results are really quite good when you remove an implant and fill that subcutaneous tissue with fat. You get a very natural look.
And you agree, obviously.
Yes.
Yeah.
Yes, that's the way to go.
And the results that you've seen have been extremely positive.
We give back about the same volume with a much more natural look
With a
and
more
no foreign
natural
body.
and a happier patient, I'm sure. So the last question I have is the future of fat and stem cells. Have we gone to the point where you don't think we're going to go any further because of FDA regulations, because of the controversy, or do you think we could go even further in stem cells
I think we're just starting the journey.
This is the journey's just
We're
beginning.
just starting.
Dr. Delvecchio.
I think we're starting to stratify between large volume grafting, buttock, breast, versus small volume, face, open wounds. In the open wound category, we'll see the use of concentrated stem cells start to have application. And I think there are other techniques like cell protectants that we'll borrow from transplantation biology to help protect the cells as they get transplanted that aren't necessarily biologic like stem cells, but chemicals or drugs that protect the cells from bursting.
So we're really just at the forefront.
We're beginning.
We're beginning. Well, thank you very much. This is really fascinating.
Thank you,
so
Pamela.
much. Thank you.